Yeah, well, I grew up in a small town in West Virginia, and my best friend's father was a true family physician. Like he was an old time family doctor. I mean, he's a very interesting guy. He was a very strong patriot as a kid. He volunteered immediately out of his internship to go to Vietnam as a medic. He was a medical doctor, but he worked as a medic. There are tapes of him corresponding back home with his family where you hear mortar shells in the background and all these things. He won the Bronze Star for his service in Vietnam. And he was very much like a role model to me. I thought that's the path I wanted to go down. I thought I wanted to be a family doctor. And I read the writing on the wall at that point that the changes in medicine that were coming, I wouldn't be doing what he had done, which was soap on fingers and birth babies and do, cradle to grave medicine, that it would be more like I'd be a gatekeeper at a portal. I didn't really want that. And I always had an interest in the intersection of science and the arts. And so my undergraduate major was chemistry, biochemistry. I think you heard my story about why I don't have a double major, which if we have time, we can delve into that. But the other was psychology. And so I'm one of those rare people that actually uses what I studied in college.
Yeah.
And that sort of set the stage for me to become a doctor. I so admired Dr. Kleinsteiber is his name. And I so admired him and looked up to him and sort of set me down that path. And then the fork in the road came with first neuropsychiatry and then ultimately child psychiatry, which are one and the same.
For you.
Yeah, for me, the way I practice.
So in the traditional path, I guess, in medicine, you'll go to medical school and you'll just study the same thing every doctor does, right?
That's right.
And so you get 4 years of
that, yes.
And then
right.
you'll have a residency, and yours ended up being with neuropsychiatry.
Yeah. So mine was, I had an internship at Vanderbilt, and mine was a little bit different than most psych internships because I didn't do anything other than medicine and neurology because I had set down that path. But once I figured out that the dual path wasn't what I really wanted to do, then I had 3 years of psych, adult psych. A running joke with me is that, to be boarded in child, you have to be boarded in adult first. And I always say it should go the other way because then you would understand the
developmentally, right? Yeah, that would make a lot more sense. Yeah,
right.
Yeah.
Create the context, right? So did the adult, and then I really fell in love with child. When I did my child rotation, honestly, I went into that thinking, I'm going to kind of grin and bear this. I don't really want to do it, and then once I was in it, I just have always been interested in people and human development. And here it was sort of unfolding in front of me. And that was the first time that thought occurred to me that if I'm going to be an adult psychiatrist, I will be so much better at it if I understand that this didn't just materialize out of thin air,
right? That
it came from somewhere.
Yeah. You have context, like the whole picture.
That's right.
I think there's so much I could say about that. I mean, where the thing you mentioned first is that you were seeing that medicine was changing.
Yes.
And it's interesting that you would describe family medicine, internal medicine as gatekeeping now, which it does seem like you can't see a specialist unless
That's right.
you get a referral, and it's almost like what those people are there for.
That's right.
Which seems to be like a waste of resources, honestly.
Well, and it's a waste of a opportunity where someone, and I pride myself on this in our own practice and what we do is like, medicine is about first and foremost relationships with people and developing that relationship over time. And again, your understanding of someone matures and equally importantly, in my humble opinion, their understanding of you matures. Okay.
Trust.
Because it is an interaction, right?
Yeah.
It's not speak to the oracle and they tell you what to do. right. Okay. So
this just it. Like, what was it, Johnny Carson would get the thing and it'd be like, oh, it's borderline personality. What would you know? Yeah.
Exactly.
Right.
Exactly.
Yeah.
Like you have to arrive at these things together. We can talk more about that later too, because it's a funny question about the best treatment plans. It stems from that. But that it's an interaction and that trust is the foundation of that, and that's built over time. And so one of the things I hear from patients every day of my life, and I've lived it a little bit in my own life on occasions when I've needed access to the healthcare system, or recently when my wife needed access to the healthcare system, that you get these discrete sort of packets of interaction, and it's like literally 10 to 20 minutes, and then you're just kind of on your merry way. And it's like, well, wait, what? And I mean, I am a doctor, and I would walk out going, what just happened there?
Yeah.
Right.
Yeah.
So there's no continuity. And I think that's what the old school approach, the primary care doctor who knew you, followed you, treated you. And yes, if there was something really outside of their expertise, they would be They would have a fiduciary responsibility, and they would be, negligent if they didn't send you for consultation, but it was consultation. It wasn't farming you out to 3 dozen different doctors.